And good morning. Good morning, everyone. Thank you so much for coming to the Up Office Hour today, Tuesday the 20th. Really happy to see you all in the room this morning. As is our pattern, I will introduce myself. I am Charles Baldwin. I am the Program Officer for the Universal Participation Initiative, UP, and I'm an older white fellow with beard, glasses, and an askew mohawk this morning, calling in from my studio in Somerville, which is the ancestral home of Nipmuc and Massachusetts peoples. And again, really happy to have you all here. A reminder that today's conversation is, I'm trying to focus it on wellness and joy. That being said, it's all about our intentions as we come into this space and being responsible for the impact that we might have either in this room or going forward. So I always like to acknowledge that. Today, we have a guest, which is why I asked you all to be on your best behavior. So it looks good, but really happy to have Cheyenne join us. She is one of the program officers in the Cultural Investment Portfolio, and she also works and leads the CultureRx initiative, which is a big, complicated, tiny initiative, similar to UP and sometimes in that regard. But Cheyenne, welcome. I'll have you introduce yourself, and we'll start with our conversation. So good morning.
Good morning, everyone. I am Cheyenne Cohn-Postel, as Charles said, working in the Cultural Investment Portfolio, the CultureRx initiative, hi Maureen, and the Gaming Mitigation Program, which is very exciting and also a lot bigger than we, this one is big and complex. So that we have programs of all sizes. I am a younger Black woman with my hair tied up in a bandana and gray glasses. And I'm happy to be here with you all talking about wellness.
Yeah, and I think, for those of us who have been doing these conversations weekly, we often, and again, I get it. Anyone in customer service knows that 99 people come through, one person has a complaint, and that's the one that haunts you all the time. A lot of this work around access is looking at sometimes the things that don't go well, the things that we've overlooked, the things that we've missed. And it's a reminder, or I want to remind us, and I'm sure we all know this, but that our art and our creative practice and the value that we bring to our communities, to individuals, is really tied into this idea of creative practice leading towards health and wellness, whether that is research and data-driven, or as I like to say, anecdotal, because I just know it. So good morning, everyone. So Cheyenne, you've been at the council not for a very long time. In fact, I think it's all been during the Great Sheltering, yes?
Yes, I started 2 weeks after the lockdown started. The week that I was offered the position, I had to make an unexpected stop into the office to get paperwork because I knew everything was shutting down. So it has been really, really crazy. And some people I was lucky to have met in person. Charles and I had a chance meeting before I got the job, and I came in for a couple interviews. But other than that, there are several people at the council that I have just not met in person at all.
These times. I'm going to ask you a personal question. In these remote times, what are you doing with yourself and your family to sort of fight the oppression of the Great Shelter and your own health and wellness of you and your family? What little things might you be doing?
My family is myself, my husband, and our 3-year-old daughter. She just turned 3 on Friday, this past Friday. Part of our health and wellness is really, we recently just moved. We bought a house and moved from a tiny 2-bedroom, yes, we did, a tiny 2-bedroom apartment to a house with a backyard. So part of that move and the sacrificing that we had to do to make it happen have been a very much part of our wellness, is that we got to a very tense, long period of time being home, all 3 of us full time for a full year. But then we moved and we were able to get some space, and she was able to run around, and now we can, and she's going to preschool, so we're not the only people she sees. So we really invested in that planning and making that very large shift for our family. Getting this new job was a part of that process. So it was a really, it was a long game for us when we started. And now that we're here, we're really not trying to take it for granted or forget that we still need to do the work. So we're spending a lot of time making sure that the house is clean, because it's 3 times as big as our apartment was. We're making sure to try to speak to a toddler in a way that might get her to stop yelling. And that is also long game intentional work that we're doing, but helps us all kind of keep that level head. So I think really bringing the intentionality to working on our wellness is our tag right now.
Oh, and I really appreciate you sharing the personal, because so much, a lot of people in the room know each other. We've been meeting for a while, and I appreciate you just sort of giving us a little sense of where you are coming from as we sort of get going on this conversation. And again, I invite anyone who is in the room, whether it's on video or audio, if you have questions that you want to put out there based on this conversation, please jump right in. So Cheyenne, CultureRx. You're gonna love this question. What is it?
Yeah, that's a great one.
I thought you might like that one, yeah.
CultureRx at Mass Cultural Council is a couple things. I think I'll start with probably the feature that I'll talk about a little bit less, but part of it is our Card to Culture program, where EBT and WIC and Connect Your Care card holders can access discounts from organizations. You really don't have to be any certain type of organization if you want to participate in this program. So the program officer on Card to Culture is Kaylin King, and she'd be happy to talk you through what that looks like and entails. And then the second part has been this social prescription pilot. We are on the second phase of the social prescription pilot, meaning that in phase 1 and again phase 2, we have created a cohort of cultural organizations that will work with professional healthcare providers. In phase 1, things were really broken down into two cohorts, one in the Berkshires and one in Pioneer Valley, and they were kind of pointed in different directions. The cohort in the Berkshires was really ready to actually start welcoming guests and taking referrals from the professional healthcare providers. Whereas the Pioneer Valley cohort was really working on relationship building with the care providers and really figuring out logistics and trust and anything legal that might come up. So in phase 2, we're really doing a little bit of a switch for the cohorts and trying to do something else. So I think with the Berkshire organizations, we are really figuring out how several of them, not all of them, but several of them are working with McAney Pediatrics, and I think that will expand. So we're working on that relationship and how it'll work. They actually have a coordinator that's working with 5 organizations in our cohort of 12. So it's about figuring out what doctors need to confidently make these referrals, what patients will be given, and what information care providers can share with organizations. And we've also really focused on, from our end at Mass Cultural Council, focused on kind of the thought leadership of social prescription. There is a much larger conversation and relationship between arts and health and medicine, both nationally and internationally. So our team is really interested in making sure that we are a part of that conversation and learning from the work that's being done, especially in the UK, in Britain. They're really doing a lot of work. London has theater for days anyway, so they're really doing a lot of this work with social prescription that's very interesting. And we have been focusing the cohort on inclusion and really what that looks like when you are meeting new clients and patients, when you're doing new processes, when you have people with new vulnerabilities. What do you need to do to be prepared? We are working on a chance for organizations to share within themselves what has been helpful for them, what has not worked for them, and just questions about the general process. But we're working on things like building trust and mitigating barriers that come up, identifying what lack of knowledge or resources might create barriers. So really finding the cause of the barriers before just trying to break them down. So it's been a really, really cool exercise. But to get back to your actual question, I would say that CultureRx is an initiative of the Mass Cultural Council where we are trying to make sure that under-resourced communities have access to cultural institutions, either through the programs, WIC and EBT, that they're already taking advantage of, or going through professional healthcare providers like doctors, social workers, therapists, and making sure that those healthcare providers can refer clients to cultural institutions as a holistic part of their care.
Well, and this is where the intersection with UP is so critical. One, as we talk about access, is access to resources, and our cultural institutions being some of those resources, and also getting the medical field to think about art and creative practice as reparative, recuperative, the benefits of. And this is where, I posted some of the data out of UK, and I know that Mass Cultural Council, with some of the organizations who might even be in this room, gathering that kind of data that supports the arts leading towards, again, health and well-being. Many of us in the boots on the ground, we know this anecdotally, we know this in our heart, but we also know data is important and will often push change. And so when we think about access to resources in our cultural institutions as centers where health and wellness can emerge from, both on the individual basis, as you're describing with some of the work that you're doing out in the Berkshires, but also on a community basis, which I think sort of resounds a little bit with what's going on in Springfield and the Pioneer Valley. Those are being the two places. So my question to people who are in the room, again, whether it's video or audio, I mean, how do you message your arts and culture happenings, other than like, it's happening now and this artist? But has anyone in this room been incorporating messages of wellness in their promotion? Rachel?
So we haven't been pushing it as much publicly, but within a lot of our grant writing, we're often talking about how the healing power of dance, and how dance can be transformative. We did a partnership with Black Box Dance Theater in 2019. They're out of North Carolina. Yeah, right in the long ago. And Black Box Dance Theater is they're out of North Carolina, and they do work with veterans. So we're applying for a lot of grants right now because they're amazing and we want to bring them back. And I yesterday got the chance to rewatch the performances with Black Box Dance Theater, and just like I'm watching them in the office by myself going, oh God, this is so powerful. Because we had a gentleman who was 83 years old with Parkinson's from Vietnam performing on stage about that experience with professional dancers. And then also a father-daughter duo where he was a veteran and his daughter was there supporting. So it was just this broad spectrum of everything that we believe at the dance complex, that dance is healing and transformative. So yeah, that's one of the areas that we're often looking at in our space.
I think your phrase, it's a broad spectrum, catches it. It's, you can spend a lot of time dividing up your messages and the audiences that it might reach, but it is really, dare I say, an overall holistic view on how we contribute to community. Am I still on base, Cheyenne, or have I sort of gone off into an up tangent?
No, I think that's a really great question, because part of what we've really talked about in some of our sessions is the fact that your message is very important. There should be slightly different versions of the message that's tailored to the audience, but that having that through line throughout the organization, that everybody knows what that core message is very important, because then everybody is empowered to speak to their stakeholders on the right terms and in the right language. And I will also say, Rachel, did you want to say something?
I wanted to ask you a question, which is tangent. It's connected. Which is, we have this great healing that our country needs to go through right now, and I'm wondering if CultureRx is going to be connected to that, or if not obviously countrywide, but the healing within the state. We've joked in some meetings. We're right by Starlight Square and in Central, and come for the shot, stay for the show, was a joke that we I don't think it's actually happening, but it was a good joke. But will CultureRx be supporting that process so that the arts can connect to this great healing that needs to happen?
Well, I will say that I don't think it'll be localized to CultureRx. Michael Bobbitt, our new executive director, is very much in that movement and headspace, and we're working on a DEIA action plan. So I think the entire agency will be moving in that direction in tandem.
What's that action plan? What are those initials?
Diversity, equity, and inclusion.
I heard DIA, not okay. Yes.
DEI. Yes. So I think it's not going to be really localized to CultureRx in any way. This is kind of a full body movement for us. But I will say that there are some organizations that are doing exactly what Charles was saying, is that they're connecting to the community in a way that's going to permeate and promote wellness in ways that people, I think, are not even thinking about. I am thinking about Mass Mocha's relationship with the Department of Children and Families. Through the CultureRx initiative, they're going to be offering, they do visitation for families that need supervised visits already in the museum. So a part of CultureRx, they're going to be able to offer free family memberships to families that move toward reunification. And what I think that really does is not only make Mass MoCA a hub in the community for families that really do need that safe space, but don't necessarily always have access to it, it also lets that family in particular look back on the memories of visitation as not a dark, singular time in their lives. They're evolving their relationship along with evolving their relationship to the museum. So I think that's a really great way of making sure that the work that you're doing lives on in your community and helps make these people's lives better specifically. And so I think the work is done in these kind of less sexy, longer term ways. But I think when you are especially working with families where the state has had to come in, if you can make their lives better and give them access to more art, more space to talk, then I think that's also doing the work on the ground.
Well, and I think it's sort of like a yes and the big and the small. I mean, this is what makes the council right on the ground with the organizations that we are serving. The shift is not only because we have a new leader, but it is responsive to these times. What is truly necessary to help move our sector forward and to make it, you know, stronger, better, more resilient. So it's just one more sort of thread. And as we think about the up office hour and what is access now, this ties in both big and small. Rachel mentioned the group working with veterans. Cheyenne, the other day you posted the woman who does the spray paint murals, and I had been looking for her and I couldn't find her, and I couldn't find her again this morning. But it was for families who were looking again for visitation between youth and adults, generally supervised, but doing something other than meeting at the Mickey D's to reconnect, but to actually do something together, which I'm a big fan of. Yes, 24-hour power. I've got to put that on my data sheet. It's a little action, but with big impact.
Mm-hmm. I really feel like it's all a part of the work. I feel like something that actually is a stumbling block for people is only thinking about the big actions, the big shifts, the big work to do. Because in the example of reuniting families and giving them a place to continue that work of trust building and building good memories as a family, we know that Black and Brown families specifically are usually don't have a strong father figure in the home, or a lot of them are just single mothers who right now are struggling, especially with things like hybrid learning. So empowering families is empowering communities, and it because you're empowering those families to have a voice and be in their community and make it better. So I think that you have to think of the small things, and you have to think of being able to empower your community past your relationship with them. So I think that's part of doing the work, is making sure you always want people to come back. You always want more butts and seats. You always want more people seeing what you have to offer. But I think a big part of doing the work of promoting inclusion is giving people the tools to create equity for themselves in their communities.
That's a good segue into the balance. Again, we know that organizations are made up of people in this room, and that you work, whether it's a group of 3 of you or 23, to push the mission forward. We talk about intent and impact, but what is the role and how do we, is it our responsibility, but what is the role of personal accountability? My own personal strengths or challenges, when do I need to, I'm not quite sure what the question is, but it's this idea of this balance between community and individual responsibility, and how do we sort of support the strength of both? Yes, Lessie, thank you for saving me from my question. That's rambling.
Okay, so like, oh, my name is Lessie Tyson. I am an African-American woman in my early 40s. I have short hair. It is not in a do-rag today because I forgot to put it up. I have glasses and braces. Hi. So it's just going to be a hodgepodge of what's coming out of my brain. I think the first step would be to realize that what you're doing is making a change. And because I know for myself, realizing my own health with everything going on and how important it is to kind of be connected artistically, it's just been really important to see that, okay, if I'm having a real bad day, I get up, I play the guitar for a hot second, and I actually feel better and I'm able to think better, and seeing that that does make a difference. So that's kind of where my brain first starts, and then connecting that with the organization that you're working with. I know we are just starting to have the conversation at Landmarks with health and wellness. So we are in the very beginning stages of starting a music and memory program that's specifically designed for folks with Alzheimer's and dementia. But it just took us a hot second to get there. And so it's just realizing the power of music and realizing that it's important, and realizing that your organization is important in doing some of these bigger work. So then when I guess when I think about it, then maybe this isn't this work, it's big, but it isn't so big. It isn't too big. I think it's within reach. So,
Well, and so often it's within the capacity, both human and financial, of the organization, but also the vision and mission of the work that you're doing. Landmarks has continually been broadening its idea of who's in the audience, who is music for.
yeah. And I think breaking that chain of like, I can't do this, or how can I help? How can I help? Stopping that and stopping that with yourself. And then because people make up an organization, if everybody does that thing where they stop that within themselves, you'll start to see a larger change. I don't know if that answered your questions, but that kind of was what came in my brain.
Well, it's a non-solution based hour. It's often getting ideas percolating. And as we think about access to joy, access to wellness, how our organizations contribute to both the individual and the community. Yes, Cheyenne, and then Stewart.
This idea of individual versus organization versus community, I think is really interesting. And Leslie, I really agree that once you give yourself permission to say, this is not unattainable, I can do this, get out of my way, and other people see you actively doing that, it gives them permission to do it, and then it becomes an organizational practice. A lot of organizations think that things need to come top down, that the board needs to sign on, and then everybody will be blanketed. But really, it's decisions that permeate. So once you do it, your colleagues will do it. The organization is then doing it. And I'm learning from preschool as well. The teacher was very much like pre-kindergarten and beyond are time for them to learn every letter, every number, every color. I'm really working on social emotional learning. And I feel like that really spoke to me in this conversation, is that as organizations, maybe we're teaching people how to play instruments. Maybe we're teaching people about modern art or nature around them, but we should all be teaching social emotional learning. We should all be teaching how to interact with the world around us. And I'm going to say appropriately, but take etiquette out of it. because etiquette really undermines the trust that you have to create with somebody to teach them how to approach the world around them appropriately. So again, like the work is in there, because the social emotional work that you do with the people in your community, it goes with them as they go back out into the community.
Even just something too, just like as I was thinking about the social and emotional development, I feel like in this time of the pandemic, there's some things that we've lost because we've kind of just been behind screens. I know for myself, I was sitting with my boyfriend and we were watching some performance and I clapped and I realized I was like, and there wasn't anybody else in the room but my boyfriend and I was clapping and he was like, there isn't any audience. And I was like, I know, but that just like makes me feel good because I haven't been in an audience. So you realize that there's a large amount of like, what do you do when you enjoy something and there are other people sitting next to you? There have been probably some kids that have grown up in in this pandemic, and they're going to have to learn applause and the importance of that. And how do you connect with other people in the room? You know what I mean?
Ooh, that's
During,
good, Lessie.
let's see, during the opening of Starlight, like the first one last year, and it was like the first gathering, our executive artistic director got up and was like, okay, everybody, I want you to put your hands in front of you like this. Now you're going to bring them together and then you're going to open them again and do it again. And he got the whole group doing this like as a movement, but like reminder about how to interact together in a fun way. Yeah, I hear that.
It's kind of like with little kids when they're young and they I know I did this. You perform and you act, and your first audiences are teddy bears and little toys in the room. And I felt like I kind of went back to that place because I'd teach myself again. And I'm now like continuously doing it, even though I know there is nobody next to me. I need that for when we meet again together. I don't know if that makes sense, but
Totally. Stewart, I don't want to overlook you. You had your hand up earlier?
No, I mean, we're sort of touching on the thought. I'm going back to the panel we had on addiction and my question about just sort of, I guess, high volume and low volume, parallel tracks, creating accessibility versus a program specifically for people's unique needs. And so we have at the Umbrella, sorry, white Japanese middle-aged male who's getting a shot today, so I'm kind of giddy. So we do have an interplay certified instructor who has a wellness movement class that's been very popular. Right before the pandemic, when I first reached out to Cheyenne, we were really just starting in a very deliberate way to work with a psychologist who happens to also teach art classes for us on the side. And we said, well, why aren't we doing these together? Could we create something that was really deliberate as an art therapy class? But it's also really resource intensive. And one of the things the psychologist was suggesting is most of the people she would prescribe might want to have privacy, as the first and foremost, factor for wanting to come into the Umbrella and make use of our facilities. And, so I guess I'm just thinking through again, you don't want to sort of segregate a whole population, but, we can be accessible or we can be deliberate. And being deliberate is much harder and more resource intensive and would really need like a partner like MCC to help us figure out how to do social prescription. And that seems to be a much taller order.
Well, there is no doubt about that. The US medical system, the US insurance system, yeah, social prescription is a whole nother kit and caboodle. And I would also say art therapy, the actual practice of therapeutically using creative practice, that may not be, again, in this crowd as administrators and artists, and that awareness is certainly key, messaging and an understanding but you don't want to put yourself into a role of therapist that isn't true. I'd be curious, Rachel, when you were working with the group with vets, so tangentially, I've been aware of different groups working on and with veterans, and the work was always done, again, by an artist, a teaching artist, but they did actually have a therapist in the room. So in case something needed to be unpacked or paused or looked at, and I bring that up in the context of, I'd be curious to know if the group was similar, but as a reminder to people in this room, as we're talking about this is not a professional, we're not looking for you to become therapists unless that's something you pursue. Building awareness and an understanding of how to create access and to be thinking about health and wellness. Anyway, that was a long one, Rachel. I'm curious if the group down in the Carolinas did that.
As far as I know, they don't. Their work with veterans really stems from, I'm going to say user experience, but that's a terrible way to say it. They have connected with a Purple Heart veteran who he started by playing music for the company, and was slowly invited into the process. And their process is really like, you are, excuse me, allergies. You are welcome into this space, and whatever works for you is what we will accept. So if you just need to sit there and witness and be witnessed, that's okay. But if you want to talk, if you want to move, you are welcome to do that with us. And they create, they have, like, the way they worked with us is they came for 3 different workshops over the course of 3 months, and incorporated the people who came to the workshops into pieces that they had, and included personal stories from their own collections, but also from those people who wanted to share. So verbal components as well. And they also, I think Nicole and Karen were both at this performance. They also, because we have 2 studios that hold performances, we started in the first floor space, and then they invited any military veterans to come upstairs with them to the second studio where the performance started, and those audience members were incorporated into the first few moments of the piece as well. So it's all by, we're inviting you in. Yeah.
I will say to Stewart's point, we are with this program not saying that the relationship between arts and wellness is all encompassed by art or music therapy. And we're also not saying that prescriptions are only for things like therapy, because we know that arts organizations are not just inherently certified to do actual therapy. We're working with Community Music Center of Boston. They're doing music therapy. Community Access to the Arts, who works with people with disabilities of all kinds. And we're working with Urbanity Dance, who has a class for Parkinson's patients. But generally, everyone else is just a cultural institution that understands and wants to be a part of the kind of building the environment in which more entities acknowledge that there is a relationship between arts and wellness. So yeah, Maureen, you want to jump in?
Yeah, I'm Maureen Hennessey. I'm from the Clark Art Institute out in the Berkshires. I'm a white, close to being senior woman with glasses who's had both my shots. Not quite fully immunized, but, and we are part of the social prescription pilot program this year. We're working with a group of independent mental health professionals. I think a lot of places are working with organizations, but we're working with, I think, a group of about 8 to 9 independent therapists. And just to Stewart's point, what we're providing as part of this is some training with the mental health providers. We put together a series of materials to help kind of prepare people for the visit. And then we're providing passes. And so, and one of the things that the folks we've been working with were very clear on was that the people who are coming to the Clark, they don't want to be in any way identified as somebody who's part of a program. You know, they just want to cut. So what we're doing is helping facilitate visits for them and a group of friends, or them and members of their family, to just come and spend the day with some preparation. And then there's kind of both, the providers are doing both kind of before and after assessments. And so it's really just the power of being in the Clark with the art. And also, we're very fortunate. This was entirely serendipitous, but we have our first ever outdoor exhibition, which opened last fall. It had been in the works for a couple of years. We didn't know how popular an outdoor exhibition would turn out to be in 2020, 2021. But we also have, you know, we provide some information on the groundwork exhibition as well. So it's both inside the building and outside, particularly for people who are still not comfortable heading inside for too long a period with other people. And I just want to put in a plug for this program. There are monthly training sessions that have been really fabulous, not just in terms of informing the work we're doing through CultureRx, but it's really information and material that can inform all of what your institution is doing. So it's been a great experience for us. You know, like everybody else, we've had to pivot, and we've gotten a lot more stuff online than was originally in the plan, but it's been great. So I appreciate Cheyenne being here.
Thank you. And that actually brings up another point that Stewart was talking about, is the big versus the small, and practices versus programs. And I think what social prescription has told us and really taught us is that scale is not really an important marker for the work that's being done. The benchmarks are really, they're much harder to measure. They're the trust that you are able to impart. It's the ability to get people to actually follow through on the referrals. So that speaks to what Maureen was saying about the materials that you provide and what you tell these clients that you have available, to make it seem like it is for them, without saying like, these people are special, move out of the way. But it's also an opportunity to realize that the lens you put on and the things you think about when you're trying to create a program are things that you should think about in every setting, at every time, at every turn. So really, social prescription, what we're trying to do is teach organizations through this very specific relationship where everyone knows that the stakes are high in terms of the relationship with the patron. Teach them practices that should then permeate everything. How to make sure that you're not just thinking of physical access, but you're thinking of language barriers, etiquette barriers, transportation, whether or not somebody can be a guest with them. Like if you're giving a child a free ticket, then they're not going to take it because their parent didn't get one too. Or if you name something for parents, then what are children who are in foster care or with their grandparents going to think? So these are lessons that we can explicitly talk about through CultureRx that should only get bigger and be practiced more often.
And now you can hear why CultureRx and UP are really so in sync with each other. A slightly different focus and a little bit more research, but this idea of, and I'm gonna, because we're getting down to the last of the hour, sort of wrap this up in this access to joy, joy and being a stepping stone towards health. So I put out the word to anyone in the room, again, whether you're on video or audio, a moment of joy that in a cultural institution that you've experienced, that you helped steward, that you've witnessed, that can be indoors in the past, outdoors, just because I'm, seeing Taylor on the call. So I'm like, I want to hear more about the outdoors. I think Samantha Nelson's on the call, and she's someone who's outdoors. And let's see, other folks who are, well, Lessie, you're outdoors too. Yes, please. Jazz, welcome to the Up Office Hour.
Thank you for inviting me. Thinking about things that sort of bring joy and that have a lot of access. I live up in the North Shore. Actually, my name is Jazzmin, pronouns she or hers. I am a Black woman leaving my 20s. And I wear these fake glasses to help with blue lights. Something that I've seen that sort of had a lot of access, or so I'm in the North Shore, and a couple of years ago, maybe they started doing a sandcastle competition where they had people come to the beach, the public beach in Revere, and carve sand sculptures. And, people had access to watch the process of that being built, right? To interact with the art as it's being made, to see the finished product and vote for the town favorite. And it brought a lot of people sort of to that beach to sort of engage with this art, and engage with this place, right, that had been a free, America's first free public beach. And I thought that was a really great way that an event and sort of a cultural event that centered around the making of art using nature had a lot of access, because all you need to do is get there, right? And it's near a train, people can walk from their houses, you can drive there. Because made of sand, right, and the artists were from all over the world, people could sort of see themselves, only that's sort of an immigrant town where there are people from all different backgrounds, seeing people from around the world coming and creating art there, sort of inspiring. And because it's a visual art, you don't need language to sort of interact with it. You just kind of you get to just see it and sort of and be there to express it. And that's something that I think that we had more opportunities like that, thinking about places that families can go and sort of just interact with art, and there's no barriers to it, really.
Placemaking is going to be so important, especially just practically. People are going to want to be outside. It's summer and we've been inside for a year and a half. But also in this work of rebuilding communities that have been devastated from the shutdown, placemaking is going to be so important. We are no longer going to be able to so freely say, you come to me, because we've been beamed into people's homes, and people are not going to want to come into our buildings that made sense a year ago. So placemaking is something that we should all dip our feet into. We have a communities department, and I think everybody should check out what they're doing and connect with the program officers and managers in there, because I feel like the more we can build up our communities and bring our work outside and meet people where they are, the bigger impacts we're going to have in our surroundings and our community.
Hi, my name is Taylor, and I'm with the Nature Connection. I don't think I've talked much on the UP office hours, but have loved being here for the past few weeks. We're a new UP designation organization, and our mission is to improve individuals and communities through the therapeutic use of nature. And so much of what everyone's been talking about today, I'm just like, yes, 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 go for it, do it. We've been doing this for about 35 years now, and just really incorporating these ideas of wellness and joy and healing And our lens happens to, or our materials happen to be nature, and our lens is arts and sciences and humanities when we're working with participants. And Cheyenne, what you were just saying about creating the space to have these programs and going out and visiting people. I just want to share that our program model is where we go out and visit people. We connect with program partners and we travel right to them. Like, so we're going to the group homes and the senior centers and the day centers for folks with disabilities. And that's where we do our programming. And it is so hard to measure. I know that got mentioned earlier too, but there's some scientific evidence that's out there, and we definitely rely heavily on that since it's so hard to evaluate in the moment in our own programs. We find articles that have talked about it from peer-reviewed journals, and we use those when we're trying to bolster the, the quantitative versus the qualitative story, anecdotal evidence. But just to say that it's very doable, and to have it worked throughout all of your programming, and so excited to have it becoming more of a thing throughout other organizations and have other programs started and going. And very happy to answer anyone's questions who are thinking of trying to do this in your own organizations and in your own work and programs.
And shout out to Nature Connection. I think it's so cool that you guys involve the community in the way you do. They bring animals and they are pets from people in the surrounding community. So you can be involved in Nature Connection and not be in a group home or assisted living, but they come and pick up your gerbil and bring them to old people. That is so cool.
And Taylor, I gave you a couple of weeks before calling you in, so thank you for sharing and for being part of UP.
Okay, yeah, we might want to plant.
No, that's just noise in the background. Okay.
I was just going to add, if I may.
Yeah.
I'm Samantha Nelson with Boston by Foot, and we went through the UP program a number of years ago, and I'm really excited to be in these office hours. This has been really helpful and very inspiring. So with Boston by Foot, it's our mission to explore the city together. And we want people to develop a deep appreciation for the built environment and the layers of history that the city represents. And of course, we're all about walking and obviously the wellness that comes from the physical walking, but also the mental wellness that comes from exploring new environments. So early in the pandemic, we, like everyone, canceled everything, but we did invite people to explore their own neighborhoods. Of course, walking, especially in the beginning of the pandemic, was kind of everyone's escape and how people found joy. And of course, it was around this time and springtime and a wonderful time to be walking around Boston. And so we prepared some activities to help people discover parts of the neighborhood they may not have noticed before. And we got a lot of feedback from people saying that, wow, I spent so much time walking in a way that I just haven't before. And I saw so much and I appreciated so much more than I ever would have. And so that was really wonderful for us to hear. And we're now excited to get back out to offer our walking tours, our guided walking tours, bringing people together to different neighborhoods. And we're hoping that we can do so and inspiring people to reconnect with their city, maybe not their own neighborhood, which they have perhaps overwalked, but to explore a new neighborhood in a different part of the city that they have not yet appreciated. And so that's we're really excited about that. And Taylor, I love the concept of going to people, where they are. And Cheyenne, that was such a interesting point, because that about placemaking, and that people may not be as eager to come to us as they they once were. But we've actually thought a lot about how can we take our programs to these neighborhoods. We already invited people to explore their own neighborhood on their own, but maybe there's a way that we can meet them in their neighborhood to help them discover, explore, and asking them questions to help them just develop a deeper appreciation for the places they live and the people that once lived there.
love that idea, Sam, because I know in Boston, you know, things get wrapped up in the sort of downtown Yankee Doodle history, and yet Boston has been around for a long time, and there's so much to see in the neighborhoods that might not be downtown. So thrilled to hear that. And as usual, the conversation is rolling along, but we have reached the end of our hour. These hours are for you to bring these ideas to fruition, to hear each other talk, and to connect. Because if nothing, as we're developing this community of practice under the UP umbrella, it really is about connecting to each other. We are each other's network and each other's resource when thinking about access in that broad, multiple touch points way. So I encourage you to stay connected. Thank you for joining us today. We'll be doing this every week for the next couple of weeks. And for those of you in the Learning Network, this is a conversation that'll be continuing in the peer session on Thursday when we talk about access to play. So thank you all very much for coming to the Up Office Hour today. Have a good day, guys.
Bye.